Hi, my name is Roseanne. I'm going to be your nurse today. Got some questions I'm going to go over about your health history, blood pressure, and just conversation. Anything you want to add, just let me know, and we'll go from there. First thing I like to do is get your blood pressure, if you don't mind. So, how are you feeling today?
Good.
Good. Anything bothering you, or not feeling well, or
Yeah, a little bit of heartburn.
is that something that's new?
No, I had a chicken parmesan sandwich for lunch. So
Okay, well, that'll do it. A little bit high, 140 over 80. Is that
that's
something
actually
normal?
pretty good for me. I'm usually a little bit higher than that.
Okay, what do you normally run?
Like 140s over 95-ish.
Okay. Do you take anything for that?
Not currently. I used to, but my doctor took me off to see how I would do without it.
Okay, and you've been hanging around the 140s
Yeah.
without the medication?
Mm-hmm.
Okay, what were you on when you were taking?
Lisinopril, HCTZ.
Okay. And how long have you been off of that?
About a year and a half.
Okay. All right. Well, we do like to see your blood pressure a little bit lower. They statistically like it to be below 120 over 80. So just want to keep an eye on that, and I'm sure you do go to the doctors regularly.
Yes.
Okay. So your general state of health. What do you smoke, alcohol, anything like that?
No.
That you okay? How about talk to me about your diet? What kind of diet do you normally?
It could definitely be better. I was doing the keto diet for about 6 months. Was pretty successful. I lost like 35 pounds.
Oh, nice.
But then I went on a cruise, and it's been really hard to get back on the diet since then. So I've probably gained back like 10 to 15 pounds.
Okay. Do you know what you need to do? I'm assuming since you worked before.
I need to stop getting milkshakes from Wawa. I think that would help.
Yes, definitely. So besides the diet, or going to milkshakes, things like that, do you like salads, vegetables, fruits, things like that?
Mm-hmm.
Okay, very good. What childhood illnesses have you had in the past? Anything?
As a child, I had tubes in my ears for chronic ear infections.
Okay.
Been relatively healthy. I think most of my issues started more in my adulthood.
Okay. Talk to me more about issues in your adulthood.
So I started with like a little bit of anxiety when I was in college.
Okay. What do you think triggered anxiety in college?
I think just the normal stress of it all. But my mom also has anxiety, so it kind of didn't come as a surprise to me.
Okay.
So I've been on and off medication for that in the past. I'm not currently taking anything around the clock, but I do Xanax PRN.
Okay. And does that seem to help if it gets to a point where it's unmanageable?
Oh, yeah.
Xanax?
Mm-hmm.
Okay. What do you do, to avoid taking the Xanax? Do you do anything to help with anxiety when you feel it's coming on?
Yeah, I do some meditation.
Oh, good. Very nice.
Try to do a little bit of light exercise, like going for a walk or something. Deep breathing, music, something like that.
Exercise. How often do you exercise? Or, try to?
Yeah, maybe 3 times a week, but again, it's just like walking at a normal
But
speed.
that's better than nothing. I mean, if you can, they say 3 times a day, 20 minutes a day, anything just to get off the couch, get your body moving. Possibly at work, take steps instead of elevators.
Mm-hmm.
Parking further away.
Mm-hmm.
These are all good things that we all can use.
Mm-hmm.
Okay. So, any other medications that you take daily?
Oh, I take Zyrtec. I guess that's a childhood illness. I've had allergies my whole life. I used to get allergy shots as a kid, but I've as an adult, I can manage it with Zyrtec
So do you take Zyrtec every day,
every night. Yeah,
every night? Okay.
all year round.
Okay. Any history, family history of allergies? I know you mentioned anxiety is the family history.
Not that I think maybe my uncle might have allergies,
Okay.
but not really like not my parents or anything like that.
Okay. Food allergies, what?
Just environmental,
Environmental,
grass,
okay.
pollen, dust.
Okay. You're not allergic to any medications that you're aware of?
I'm
Oh.
allergic to Lexapro.
Okay. And what happens?
I have a prolonged QT interval.
Okay.
And I'm allergic to Cipro. I get flushing and tachycardia.
Okay. All right. Okay. Now, with the medication Zyrtec, is that the only one you take around the clock?
No, I also take Synthroid. Well, levothyroxine, take the generic.
And what is the dosage for the Synthroid?
50 micrograms.
Okay. And when were you diagnosed with the hypothyroidism?
Only about a month ago.
Okay. So you've only been on that a month.
Mhm.
Okay.
And then, do you also want like vitamins, or did you just want prescription?
No, anything over the counter.
I just
know,
take
anything-
vitamin C
Okay.
every day, just to maintain health.
Okay.
And then I take prenatal vitamins.
Okay. Very good. Do you have any like financial difficulties with getting medications? Okay.
I have pretty good insurance.
Okay. Very good. So what is the current, what the age of your parents and their health status right now?
Well, my parents are young. My mom had me young, so she's just 50. She has hypothyroidism as well.
Okay.
I'm pretty sure that's all she has. And I don't actually know my father, so I don't know his history.
Okay. So no high blood pressure, cholesterol, anything with your mom?
No,
That
I
you're-
mean, she has obesity as well.
Okay.
So that's definitely a genetic thing.
Okay.
I think she also just, might need to lay off the Wawa milkshakes too.
Okay. Okay.
She likes McDonald's a lot.
So maybe together that's something your mom and you could, maybe start exercising and doing a healthy, diet
Mhm.
together. I mean, sometimes when you go together and do things, it's a little easier. You're accountable for each other.
That's
So
true.
that may be something that's, good for both of you. So we did talk about activity, how often you exercise. That's also good for, the blood pressure, obesity, all that kind of thing. So it's definitely something you want to incorporate. Let's talk about your sleep pattern. How many hours a night do you sleep on an average?
9
Okay. Any
every night.
every night?
Not on average. Always 9.
So do you have children?
I do. I have a 3-year-old.
Oh, very nice.
Mhm.
And he allows you to get that much sleep? Okay.
He sleeps 11 hours every night.
Alrighty. Very good. No trouble falling asleep? Anything like that? Okay, good. Snoring that you're aware?
My husband says occasionally. I think it might be more related to my allergies.
Yes, that's what I was
Um,
thinking.
But yeah, not anything that, like sleep apnea or anything like
Okay.
that.
So currently, whom do you live with?
My husband and my son.
Okay. Any pets?
We have 1 dog.
Okay. All right. No allergies to the dog or dog hair or anything like that?
No, I think when I was tested when I was younger, I had like a mild allergy to dogs, but I've had dogs my whole life and it's
Okay.
never been an issue.
Do you feel safe at home?
Yes.
Okay. No one's ever made you feel out of place or anything like that?
No.
Okay. Very good. So talk to me about, like, what do you like to do for fun? Entertainment? Hobbies?
I don't know. I just recently got into like DIY projects with doing like furniture painting. I like to take like, things that you would find at a garage sale for like $5 and restore them. So
Nice.
I do that.
Okay. Does your husband and your son like to
Yeah,
help?
I rope them into a lot of my projects. My son is more excited than my husband, but
That's,
You know.
I mean, it's just a nice family, family thing to do, and it's healthy for everyone. So, spirituality, how important is that in your life?
I wish that we incorporated it a little bit more. I was raised Catholic, but we were more of the Easter and Christmas church kind of goers, and it was really important
We'll have
to
to
me.
talk to your mother about that.
I know there's a lot of things we could talk to my mother about. When I started having my own family, I really wanted to change that and go every Sunday and really raise my child differently. But work
time.
and
Yeah,
I know.
everyday activities and
But we have
things like
started in the past couple weeks or so praying together. My husband and I have incorporated saying a little prayer before we go to sleep, so that's been helpful.
very nice. So I just want to talk a little bit about your education. What is your highest level of education?
I have a master's degree.
Nice. And currently you working occupation?
Oh yes, I work full time
Very nice.
as a nurse. I never want to be a nurse.
You didn't tell me you're a nurse.
I know.
Okay.
Sorry, I'm a school nurse, so
Okay.
Yeah.
Nice. Family history, nursing?
my mother's also a nurse.
Oh, very nice.
And my brother's in nursing school.
I was
and my
going to ask you
cousin
about your
just
siblings. Okay.
Started nursing school, so
Good.
we breed nurses.
Very good. Very nice. So lastly, just any concerns about your environment? What do you think is like the biggest issue with the environment and health and anything
Like,
concerning?
Personally, how the environment affects me.
Mhm.
I mean, I guess I would like there to be less pollution. I don't really think getting cancer was going to be a fun time, but I'm pretty good with using SPF and
Oh, good. I
things
was going to
like
ask about that
that when
sunscreen and especially in your son and yourself.
mm-hmm,
You want to take care of your skin. Do you go for your yearly checkups?
absolutely.
Mammograms, skin
Well,
checks?
I'm too young to get mammograms yet, but I do my breast exams.
Oh, nice.
I go for all my pap smears.
Good.
I go for annual skin checks with my dermatologist, and I have lab work done annually as well.
Nice. Okay. Anything else that you would like? Any concerns? Anything happy, sad? Anything you would like to talk about?
No, I don't think so.
Okay. Well, thank you very much for your time, Alexis, and have a wonderful day.
All right, thank you.
Thanks.